Hey guys, my name is Caroline, and I'm here today to talk to you about how I switched from bedside nursing to informatics. I got my BSN in 2017, and I knew in nursing school that maybe bedside nursing was not for me. I had thought about other options, but I decided to go ahead and work in the hospital, get my experience, and at least give it a shot and see how I liked it. I started out on a PCU floor where I stayed for about a year, and then I transferred into the emergency department, which I really loved. I thought in nursing school that I wanted to be an ER nurse, and I truly enjoyed it. I had a lot of fun with the people that I worked with. I got to see a lot of different situations, and I have a bunch of crazy stories. But as time went on, I realized that ER nursing and bedside nursing in general just really wasn't for me. There were a lot of things that I wanted differently from my life and in work-life balance. So I decided to make a change, but I didn't know what I wanted to do. So I looked into different graduate programs and I found informatics as an option. And I knew that it was something that I had considered while in nursing school and something that I was interested in now. So I looked online for a lot of information about nursing informatics and informatics in general, and I searched YouTube, and one of the reasons why I decided to make this video was because there are a lot of nursing informatics videos that are informational, but not a lot of videos where people are talking about their personal experience and how they actually went from point A at the bedside to point B working in an informatics role. While I was in the process of doing some research on how to enter the informatics field, I got an email from someone at my hospital saying that they were looking for proctors to help with training new staff members on using the EMR. I thought, this is something that I use every day, so I'm familiar with it, and this would be a perfect opportunity for me to kind of get my foot in the door and see what informatics was really about. So I sent in my information and applied, and they quickly responded and allowed me to come to these training sessions and just basically stand in the back and give any assistance to people who got stuck as they were trying to learn the charting system. And I also continued to look online, even in my health system's hiring page, to see if there were any jobs available that sounded like something I could do to learn about informatics and get started in informatics. I think what really helped me get a job in the informatics field was that I sent an email to the director of the department that I wanted to work in and just said, I'm a nurse, this is what I'm doing now, but I'm really interested in informatics, and I'm wondering if I could just come and talk to you or have a telephone visit with you to learn about what you do and how you got into the position that you're in. I was fortunate because she was very kind and reached back out to me and offered to meet with me to discuss what she does, what her department does, and how I could potentially start working in that type of field. So I went and met with her, and I got a lot of useful information, and she actually told me about a job opportunity that was going to be available in the coming months and asked if I would like to be notified when that application was posted. And so of course I said yes, and now I work in that department. So my current role is in ambulatory clinical informatics. I'm a support specialist. So what that means is that I am assigned to certain ambulatory care practices. So for example, a primary care office, a cardiology office, a rheumatology office, and so on, that I assist with any EMR questions or issues, and also with optimization of the EMR. So for example, if a doctor says this part of the system really doesn't work for what we're trying to do with it, I need this to be better and to work better with my workflow, we can present those requests, and we act as a liaison between the clinical team and the technology team. In my current position, I'm not doing any hands-on patient care, and I do miss that sometimes, but for me, this is a better fit. I'm able to work with clinicians like doctors, nurses, medical assistants, and mid-levels to help them utilize the EMR to its best capacity so that they can spend more time actually interacting with and caring for their patients and less time worrying about technological issues. So I do feel that I have an impact on patient care even though I'm not touching any patients directly. I work in the outpatient or ambulatory space, so I don't use a lot of my nursing knowledge on a day-to-day basis other than understanding what the clinician is asking for and why. Someone who went into a nursing informatics role, inpatient in a hospital, will probably use their nursing degree a lot more. So if you want to keep that clinical piece and utilize it more in your day-to-day, then I would recommend doing an inpatient nursing informatics role rather than an outpatient clinical informatics role like what I do. So now I'll talk about pay differences. So my pay did not really change at all, but the difference is that as an ER nurse, I made shift differential. So I worked a mid shift and I made more during the nighttime hours. You can also pick up overtime as a bedside nurse, and that's not an option with my current role since I work a salaried 9-to-5 position. Speaking of 9 to 5, that is a big selling point for me on the position that I'm currently in. A lot of people love 3 12-hour shifts as a nurse, and I was okay with them. They did give me the opportunity to travel a lot without taking any time off from work. However, I'm very much a type A, routine-oriented type of person. So having changing shifts every week and having to try to coordinate my schedule, not knowing when I was on or off, and working around those long hours was really not what I wanted personally. My family and friends mostly work 9 to 5, so it was hard socially for me to be on a different schedule than everyone else. That isn't the case for everybody, but for me it was a big selling point on changing to a different position. So I hope this video was helpful to someone who may be interested in leaving their bedside nursing job to move into an informatics role. If anyone has any questions, please let me know. You can reach out to me on social media, which I've listed below, or you can email me, which is also below. And thank you so much for watching. I hope you like and subscribe, and I'll post more videos. If you have any questions that you want to leave in the comments, I'll try to address those next time. Thanks so much. Bye.